Are you unsure about the SCA? Maybe you've been preparing with colleagues, but you're not sure whether you're getting the right feedback. A common reason why GP trainees fail is that they're not getting constructive feedback. In this way, I'm going to pull back the curtain so that you can learn from one of the immersive workshops we ran. You'll see how constructive feedback can have a major impact on your progress.
When the patient say pacemaker, you didn't readdress that, and then you just say we'll come back to this. Patient is building more anxiety. Now they're telling you about the running. He also mentioned the heart attack. It's the second time he mentioned the heart attack. There's a cue here. It's not been readdressed well. To make sure that we readdress this anxiety, explain the patient what you've got is not a heart attack. I know that your dad had a heart attack, but this is a separate issue. What it is that the rhythm of your heart is irregular and it's very treatable. You did mention about pacemaker. Now, this treatment does not consist of having pacemaker. We could treat it with medication, so you don't have to have a pacemaker. So you see how I'm readdressing one after the other here. But if you come back to it, it's not a really good idea because they're still worried and you're just pushing your doctor's agenda with the medication, with the scoring system. And you want to follow the cue and pick it up and readdress this. I can see that you've had some trouble with your heart and blood tests and a trace of your heart. Could you tell me what led to the test for you?
Well, yeah, I mean, about a week ago, I felt my heart beating faster and like palpitations, and it comes on like a few minutes, a few times a day, and I was scared. It's never happened to me before like this. I've never experienced anything like this before, so I asked to be booked in to get some tests done. And I have to be honest with you, doctor, that my father died of a heart attack. He was just a little bit older than me, and I'm worried that I'm going down the same route. So that's where I am at the moment.
I hear you. I can see why you'd be worried. Can I check how old was your dad when he had a heart attack?
But he was 67.
Okay. So just to help me understand here, you feel your heart racing. Did you faint at all?
No.
No. And have you noticed any triggers to it?
Well, I'm wondering whether it's stress related. Um, that sounds something that everyone says, but when I get a bit tense. I think it might trigger it, if I'm honest with you.
Has there been any changes recently?
Um, well, uh, not real changes. I mean, there's always a slight financial stress, but that's not too bad. But I think he's just getting older and trying to stay fit and trying to be healthy. And this has come out the blue. I've never had, I didn't expect this to happen to me. I don't smoke, I hardly drink, and it's a bit of a shock, if I'm honest.
I see. Well, I mean, it's the right thing that you got in touch with us because I've got the results now. And if you want, I'd like to go over it and then we can see how we can help with the symptoms. So the heart tracing did show that your heart was not beating regularly, which is sometimes what can cause this palpitation. And it can go a bit faster than usual, which is why you're feeling like it's racing. However, this is a very treatable problem. And the name for this is called atrial fibrillation. I don't know if you've heard of that.
I looked it up, but I didn't really understand it, if I'm honest.
Okay. So it's nothing to do with heart attack. I can
Oh,
reassure
right.
you.
I thought it was a precursor to, having a heart attack or something.
It's a separate condition, right?
Right.
So this condition is to do with the rhythm. The patient's problem becomes our problem, you know? So we need to readdress it. We can't just park it and then leave it and explain to them about the medication or all the thing we want to do. We need to readdress it. Other things you might want to consider would be any caffeinated products as well, because that could be a trigger. So let's hear it from the role player.
I think you were very clear in explaining stuff to me, so I got that. But before Erwin made you do it again, I was a bit lost with a lot of, not technical jargon, but a lot of medication thrown at me. And I didn't feel that when I showed a concern that you didn't say, let's look at that concern. I understand that. Let's explore that together. And I can see why you would be concerned. After Erwin spoke to you, then I really felt that you did slow down and I felt much more comfortable with you explaining to me. The bombshell about the blood thinner was a bit of a bombshell, that I had to take this drug to slow my heart. Then all of a sudden I had to take another drug to thin the blood. And that was a bit confusing. So I tried to understand why I needed two drugs, if that makes sense. Yeah. But you did explain it. And at the end, I felt confident that I would have to take these to stop it getting worse. But I was still quite anxious, I guess, over the whole thing.
Would you say that in that situation, I could have discussed the blood thinning medication first, and then, because his main problem was palpitations, or
So the way I would do it would be explain the patient that there are two medication that would recommend to start you on today. The first medication is a blood thinner to prevent any blood clot that might form that travel to the head. The second medication is to slow down the heart and control the rate so that you don't feel that palpitation. So when I do it that way, then even if I don't have much time towards the end, everybody knows that there's two medications that I'm thinking. All right. But the way you did it, you save it for later, which is not good. You want to tell it right away so that you set the right expectation. It's two medication we're going to talk about. Does that answer your question?
yes.
And in the beginning, try and not interrupt the patient, because I think you did interrupt the patient and then just stop the flow. And that is going to harm your data gathering. All right. So try and listen and pick up on these cues. Cues are very important. It helps you if you pick them up.
Are you feeling anxious about the SCA preparation? Maybe you're not getting constructive feedback, you don't know whether you're doing the right thing. If you're looking for one-to-one support, I'd love to help you. Click the link down the description below to book a call with me to see how I can help you to pass your exam.
It's important that you show that you're listening and you don't ask questions that are out of context or doesn't show that you've been listening. For example, one of the questions you asked was about smoking, and the patient was a little bit annoyed about that question. So make sure that your history is more targeted, so that you're moving the consultation forward. But the problem is that once you were in clinical management, then you started to go back in data gathering when you jump back with any retention, any problem with the numbness at the bottom. Was the patient already told you that the catheter is draining. So it's important that you ask the right question, and also you don't jump back and forth from data gathering to clinical management. Okay. With the clinical management here, the problem is that you spend a lot of your time discussing about the examination, but you're not being assessed on examination in the SCA. That's a problem that a lot of trainees don't understand. So yes, you could arrange to see the patient for an examination, but you don't want to waste a lot of your time in the examination, what you're going to do. But what you want to do is explain what are the concerns here. Usually for pyelonephritis, the treatment would involve treatment for the vein, and I can appreciate that you don't want to be going to hospital because of the previous experience. We can see you today and see how severe this is, but my concern is that you could have an infection of your kidneys, and safest place is for you to be assessed in the hospital to have urgent blood tests, treatment for your vein with antibiotics.
If you found this video useful, then I'm sure you're going to get a lot from watching this video. Click the video to watch it. Take care, everybody. Bye-bye.